Perfect. Hi all, I am Ginal Patel. I'm the AMU lead pharmacist, and today just going to go over a brief overview about the acute medical unit pharmacy service, and that includes Richmond ward and Cavell ward. So the structure of our team, so there's an AMU lead pharmacist, which is myself, and we have senior pharmacist also. I'll go through a few of their roles on the next slide, but there is one that's a coordinator, and there's a couple that attend the ward rounds. There's one on Cavell ward and one on Richmond ward. And there's also junior pharmacists. So we have 3 based on Richmond ward and 1 on the main ward and 1 on AAA. There's also clinical technicians, and there's 1 on Richmond ward and 1 on Cavell ward. So their roles are mainly to do with medicines management with stock, and they do a bulk of our drug histories as well on the ward. And lastly, there's assistant technical officers. So there's 2 on Richmond ward, and they are based in the AMU Richmond ward satellite pharmacy. So that is where we dispense most of our items, or in fact all of our items. The only ones we don't do on there is controlled drugs, which get done in the main pharmacy in Lanesville wing, and blister packs. And blister packs, we might have to start, but the blister packs, sorry, the lights went out. The blister packs, which get outsourced by a local pharmacy, but they deliver on the same day. So in terms of contacting us and the best way to kind of contact us, so first of all, our regular day pharmacists on Richmond ward work from 9:15 to 5:35 every day. And outside the satellite pharmacy, as I mentioned on Richmond ward, where we dispense all our medication, there is on the door, as you can see on the picture on the right, is a pharmacy team allocation. So this will let you know what pharmacist is covering which bay, because the pharmacists get allocated patients as per the bays. So it'll be, you can contact them on that number, or you definitely see them around. That way you can definitely help us coordinate our workflow. And second of all, there is a main coordinating pharmacist, and their role is to allocate the workload for pharmacy, as well as the TTO. So they're the know all of the whole ward, and there is one daily, and there are senior pharmacists, and they're contactable on 8008. So that's our boo bleep. So definitely contact that if you have any queries. Otherwise, the pharmacist undertaking the bays. The ward round pharmacist, as I mentioned, so there is 2 ward rounds which we attend. So that's a post-night ward round from 8 a.m. to 11 a.m. Myself attends most of them, but there are the senior pharmacists which also attends the ward rounds. And there's also the ward round in AAA. So these are the take patients. We'll attend the ward round with the consultants and the junior doctors from 11:40 to 8 p.m. at night, and they are contactable on the bleep 7878. And lastly, just to highlight, there is a resident pharmacist. So they are 1 pharmacist for the whole of St. George's Hospital and QMH at Roehampton. They start at 5:35, and they work overnight to 9 in the morning. So they're 1 pharmacist. So for any urgent requests, please do bleep 6267, but do note there's just 1 of them working on site. They also are present from 1 a.m. to 6 a.m. on Richmond ward. So they are there in person, and they review the patients overnight. So on our post-night ward round, a lot of the work is done, and we can kind of focus on medicines optimization. So do please ask them any questions if you have any urgent requests or any drug histories that are that you kind of need more information about. They'll be able to help with that. Lastly is what we do. So what we do is a bunch of few things. So here's a few. We do the drug histories and medicines reconciliation. We also provide prescribing advice, do education and training, advice on TDM and management of dose adjustments, a lot of governance related tasks such as stewardship, antimicrobial, controlled drugs, and overall medication safety. We also provide advice on medicines such as compatibilities of IVs, syringe drivers, HIV or chemotherapy drugs, and how compatible they are with each other and their fluids. Also drug and formulation alternatives for swallowing difficulties if people have enteral tubes, etc. And lastly, just ordering medicines and discharge teachers. So we are always around to help. So please contact us if you have any questions at all. We're a friendly bunch, we hope. So we're always on the ward, present on the ward. So do ask us for any questions. One way you could probably definitely help us is definitely use the satellite pharmacy on the door, that contact list, or pop into the satellite pharmacy. The coordinating pharmacist is always sitting in there the majority of the day. So any questions, do please ask them. Second of all is just a drug history kind of mention. Do please try as much as you can to get the information regarding drug histories. But as always, we are here to help, but use the HIE system, which is now available on iClip, to find out what medications patients are on. But again, we are always here to help. So thank you very much, and I hope to see you around.